And now it's time for our Ask the Doctor segment, where we tackle your burning questions with Dr. Hanna Merchant. Hi, Dr. Hanna. Thank you so much for being here again. It's always great having you.
Thank you for having me again, Valerie.
Today's question comes from Lonnie, who says that she's struggled with her weight all her life. It's been a roller coaster ride. Should she consider taking weight loss medication?
Well, Lonnie, that question is very loaded. There are a lot of weight loss medications out there. There's one that is really the big rage right now, and that's called the GLP-1 agonist. Okay. And I promise that's the only technical term I'll use.
Okay.
So basically, the way these medications work, they help to suppress hunger, and they also help to slow down the movement of food through the GI tract. Previous weight loss medications, they may have done just one thing, either suppressing hunger or they work a different way. This one is really revolutionary because it works in two different ways. The medications have been around for a really long time, at least 15 years.
Wow.
And they were used to treat diabetes, and we found that these patients who had diabetes, they were losing weight, and so the indication has moved to weight loss as well without diabetes. The one really great thing about these medications are that they help protect your heart against heart attacks and strokes. We have found that there are decreased incidences of these with use of these medications. Also for diabetics, it's a great medication because it helps you to lose weight as opposed to other diabetic medications like insulin or certain pills, which actually make you gain weight. You know, one great thing about these medications, Val, is that they're once a week.
Wow.
Can you imagine? A lot of diabetes medications are several times a day, and it's so hard to remember to take them. So one really important thing that you need to remember is these medications are part of a weight loss program. You don't use them by themselves. We're not going to just give you the medication and say, okay, see you in a few months.
Right.
Used properly, you can lose between 15 to 20% of your body weight within 4 months.
Wow.
But this medication is not for everybody. It's not meant to be, you know, something if like you want to lose those last 5 pounds to fit into a cute dress. No, that's not what these medications are used for.
Okay.
The way we determine if these medications are right for you is based on BMI, which stands for Body Mass Index. You can go online on any search engine and look up BMI calculator. You input your height and weight. A BMI greater than 30 will qualify you for these medications. A BMI greater than 27 with an obesity-related complication, which can include diabetes, high blood pressure, arthritis, that will also qualify you for these medications. Now, these medications I mentioned need to be part of a comprehensive weight loss program. That means you still need to work on your stress. You still need to eat healthy. It doesn't mean you take this medication and then go eat whatever you want.
Right.
So you want to eat healthy, you want to have adequate sleep, and you want to exercise because you can lose muscle mass with these medications. You want to lose the fat, you want to build the muscle. So make sure that you're still continuing to exercise. Keep in mind, these medications do have side effects, so they're not for everybody. Also, they sometimes just don't work. So it's important to really stick with the program in terms of the sleep and exercise like I mentioned previously. Because the last thing you want is to stop the medications and then have all the weight come right back and even gain more weight because you didn't control the other things that maybe contributed to gaining the weight in the first place.
Oh yeah, that would be frustrating. Thank you so much, Dr. Hanna. Great insights. So friends, if you have a question for our medical contributor, head to our website, fashionsenshawaii.com, or to our Instagram and Facebook page, Fashion Sense by Valerie, and keep in mind to work together with your primary care physician for any health needs.
Tune in for your daily dose of fashion sense on Spectrum OC16.